Good. Well, probably a little smaller group expected today with the holiday weekend, but you know, it is what it is. And I'm pretty excited. How did it go last week? I was over on the coast freezing to death.
We didn't get very far.
Oh?
You know, he had a DVD, but so many people asked so many questions, right, Gene?
Yeah, it was good.
It was good,
It was
though,
good.
yes.
I mean, it's
Awesome.
typical when Gregor's, you know.
Yeah.
And we didn't get through it, but you know, one thing I notice, and I'll say this, is some people come, just the way their mind works, some people come for like intellectual knowledge, you know,
Sure.
and this is stimulating
Sure.
to them. And other people come for practical knowledge, like how to make the food, and
Right.
how to, you know,
Right.
and so there's two different, you know, kind of interests. And what happened is it started off with intellectual knowledge and it went towards, you know, what recipes we could use.
Gotcha. Yeah, well, so that's good, you know, and that's a, you know, the spectrum that, you know, we need to cover. I always say, you know, we've got to wrap our minds around what we're doing and why we're doing it. But it's also kind of fun to have some, you know, like practical applications. So now I can go home and actually, you know, plug this in. So pretty awesome. So. Well, today there's some handouts in the back there. Hopefully you all grabbed as you came in. Interactions with dietary compounds. We're on that section. We're going to be moving into the nutraceuticals and prebiotics, which is kind of you know, I just get fascinated every time I look at this. Good morning. Come on in. And so I just get so fascinated. Pull up a chair wherever you'd like. And that's my honorary wife, Margot, right there. Margot, this is pulled up. See, I do have an air conditioner in my doghouse, so I'm good. So, you know, when we start talking about nutraceuticals, you know, that is just, to me, so fascinating because we start talking about how food is actually medicine. And so we've got pharmaceuticals, we've got nutraceuticals, and then I'm going to introduce Dr. George Paplona Roger. Has spent much of his life actually developing and promoting nutrition and herbal remedies, kind of more homeopathic.
Is that the book?
And these are the books, yes. And so he's got a series of, I want to say there's 3 volumes on foods and their healing power, and then there's a couple on medicinal plants. And you know, years ago when I got these, I mean they are. I forget how many hundreds of dollars was spent on that, but I just have enjoyed it so much. I use it as a reference.
Are they still printed today?
I believe so, and hopefully a little more cost effective than when I purchased them. But you know, and so we can pass that around. You can kind of take a look at it, and definitely I would encourage, you know, Amazon. There's just so many you know, opportunities there, but this to me just kind of helps tie in the whole concept of nutraceuticals. You know, how you and I can actually go to Rayleigh's and go to Winco and actually decrease the need to go to the pharmacy. You know, and so again, that's where I kind of get excited. So I did make a couple of copies out of the Encyclopedia of Foods. You got a double-sided there, and then the medicinal plants, you got a single page. I know a couple of weeks ago we were talking about vasodilation, and I had an individual here that was talking about you know, diabetes-related neuropathies, and we talked about viscosity of the blood and perfusion of tissues, and I mean, you know, it's fascinating stuff. But it's also fascinating to realize that things like garlic actually open up blood vessels, actually increase the perfusion to our lower extremities. You know, things like caffeine actually cause vasoconstriction, so we get the blood vessels actually, you know, shrink and become smaller. And so if we want to decrease perfusion, that's going to be one mechanism. Yes?
One of the biggest problems, well, one of the problems, there's a lot of people that have migraines, and caffeine is their saving grace.
Right.
And so when you start stimulating the circulation, it actually creates the migraine.
So in that, you know, the complexity of how our bodies are designed. You know, when we start talking about, vasoconstriction can actually help with the treatment of migraines, as Gene has brought up here, and he's absolutely correct. You know, we really start looking at the pros and the cons. You know, so if we're addicted to caffeine and we're overusing this drug, you know, what effects is that going to have on our bodies, and is there a better way to actually start working on preventing the migraines? So it's kind of, you take some folks and you kind of walk them around, and you then start looking at the problem from a completely different perspective. And you know, again, that gets to be kind of exciting when you can actually, you know, help folks understand that, you know, if I can prevent the migraine, then I'm not needing to overdose on you know, Excedrin migraine, you know, things like that. So it's kind of fun, and nutraceuticals are definitely going to be, you know, potentially playing a very significant role there. So.
Is it something that you can't just give one-line advice and it can't happen overnight, or is it something?
As far as the application of nutraceuticals,
right.
You know, there's a lot of individual variance.
Okay.
And you know, and that's again when folks, I'm seeing individuals that are on a very broad spectrum of medications. We have to be careful because the nutraceuticals might react negatively to their prescribed medications. You know, and so there's that fine line that we absolutely need to walk very carefully.
If you're trying to medicate yourself with food instead of pills, but if you go to your doctor, who do you go to say, this is the food I'm eating to correct this? And he's going to tell you, because doctors just know to prescribe pills, well, don't eat that food. Who are you going to get an explanation from of to stop taking the prescripts, or, I don't know.
Awesome point. And you know, I think, you know, Doc Meyer, you know, and I've been in this class with him leading, and I very much appreciate his bluntness. He's going, doctors aren't trained in that. They are not going to support that. They're going to look at you with a blank stare and tell you to go back on, you know, on something that they know. And I will. That's again, I think, part of the excitement of having a class like this and a venue like this. In my specialty clinic at Feather River Hospital, to have individuals in, you know, with a discussion similar to this, and have folks walk away realizing that, wow, you know what, yeah, I need to be in touch with my doctor because he's prescribing me medications. I need to be aware of the potential interactions, but I need to start taking a proactive approach with an emphasis of prevention. Yes?
No, it's finding a doctor that's willing to support your decision is the hard part. Where does one go?
Great question. And I think that, you know, there's really no easy, I can't give you a list of doctors here in Red Bluff. I can tell you I've had interaction with you know, some doctors here you know, in the Red Bluff area that are very supportive and actually have proactively referred patients in my direction, simply because they know that, yeah, while I'm going to be prescribing medications when felt to be appropriate, the most important medications that I'm going to be talking to them about are nutrition, hydration, rest, activity, also known as nutraceuticals. So
I'll have to hold.
meet with me, yes, meet with me after. I don't want to go through a list, you know, of doctors to go to and to avoid, but yes.
May I have that volume, please, of that book so I can write down the author?
Yes.
Yeah, I'll give it to you. I'm
It's-
just writing it down.
It's going around. Gene's,
Gene's
we might have to
hiding it.
pry it away from it.
Gene's hiding
So,
it.
yeah, somebody having a, you know,
There you go.
little, you know, alarm, we'll give everybody no more than 5 minutes with the book. That's great, I love it. So, yeah, so it starts getting exciting when we start recognizing that, you know, the person we see in the mirror needs to play, and that pivotal role is theirs when it comes to improvement of health. And I think that's kind of where over the years, I mean, you know, when you reverse, the first person that we reversed diabetes, you know, I was going, wow, this is so awesome. You know, the 20th person, the 40th person, you know, the 100th, having a person lose 150 pounds, you know, having people that I'm now having to start tapering down on medications and getting rid of proton pump inhibitors, you know, because they no longer have that severe reflux and substernal, you know, pressures, and you know, and I got to tell you, the excitement level just starts going up and up and up, because you're sitting here going, wow, I get to go to work today, and I get to meet new folks. I get to meet folks that we have made positive changes. And yes, I may have some of them on multiple medications, but these folks are starting to understand nutraceuticals. And that's where this group, this class, is just so exciting to me, because it allows each one of us to walk out of here going, you know what, this next week is going to be a vegetable-filled week. And I'm gonna be able to understand the role that my breakfast, my lunch, my dinner, the role of not snacking, the role of not, you know, drinking the sodas like I used to, or, you know, whatever. And so as we start incorporating these positive changes, then we start getting ourselves back on track, because I think every person that I've ever met and been privileged to work with has the goal of, I want to have the highest quality of life. And so when I look at that as each individual, every one of us in this room, we all want to have the highest quality of life. If you don't, see me afterwards, because we've got to get you into the psychiatric office ASAP. Just kidding. But it's truly the importance of incorporating and learning how to apply these very important health principles. Come on in. There's some handouts on the back table there. Help yourself. So that's just kind of a rundown of things to come. And as always, I wanted to start with a text from Scripture, and I know I've used this one before because I love it. You know, Proverbs 17:22, it says, "A cheerful heart makes good medicine, but a crushed spirit dries up the bones." Well, let me tell you, you don't go to the pharmacy and say, you know what, I need a cheerful heart, because they're going to give you the same look that the doctor is going to give you when you say, you know what, yeah, I'm trying to work on my blood pressure by eating more garlic. Got a response that I would, you know, and so it's very much, you know, when we start recognizing that a cheerful heart, well, I got to tell you, the cheerful heart happens, it's multifactorial. It happens when we have good nutrition. When our nutrition comes in a blister pack like this, we pop it open, we got an apple. I've seen apples in blister packs, right?
Oh, really?
Go to Costco, pretty awesome. You know, I'm sitting here going, wow, there's a blister pack. Pharmaceutical drugs used in the treatment of disease. Nutraceuticals, nutrients that can prevent disease. I love that, because I think that very much summarizes where our focus is. If you and I can focus on that ounce of prevention and never need 5 pounds of cure, I got to tell you, my smiling muscles are going to work better, and it's going to be a lot easier for me to identify with you as we are talking about having a cheerful heart. Let's open with a word of prayer. Dear Heavenly Father, thank you for this beautiful Sabbath morning. We thank you for each individual that's here today. We ask for your presence to be in this place as we discuss health and nutraceuticals and learn more about the tools that you have given us in nature to actually improve our health. In Jesus' name, amen. So is anybody excited about nutraceuticals? All right.
We're all excited.
Yeah, we're okay. No, okay. We can quit jumping up and down with excitement. Yeah. So, any testimonies? Any challenges?
I think my challenge is that I'm starting a sugar fast, so I'm grumpy, pardon me. Is that when you can eat bad stuff,
Mhm.
whatever mine was chocolate, or whatever your poison of choice, I guess, I kind of, as I go through the day, I grab something out of the candy drawer, and it kind of makes you feel good. Well, if you can't eat in between meals, and you can't eat any chocolate, or whatever, what do you do for fun?
I love it.
You know what I mean?
Yeah.
I don't mean like doing something wowie, just something to get you through the day,
Sure.
make you feel good.
Right. So bottom line, you've heard me use the word balance a lot.
Yes.
I hope, because I think that it's real easy to become imbalanced, and it's real easy to start trudging. And I meet a lot of folks that trudge. They get up in the morning, they trudge. They're not looking forward to what they're eating. They're not looking forward to the fact that they're going to the gym. They, you know, it's a trudge. We've got to enjoy what we're doing. And I will just tell you, when you start feeling like, you know what, my life, my quality of life is less because I can't eat between meals. What do you think I would recommend?
Have a protein drink.
Okay. So a protein drink. Yeah. Some fruit. Okay.
But that's snacking.
How
That's-
about
that's-
water?
Okay. So water.
Exercise.
Exercise. Okay. So we're all different. You know, my oldest daughter, I could say, okay, we're not going to snack between meals, and she'd go, okay, Dad. She'd eat enough of the meals, she wouldn't even think about snacking between meals. I say, you know, my youngest daughter, completely opposite. I say, you know, we're really not going to snack between meals. So what is my youngest daughter thinking about all day?
Food.
Food. Wow, what am I going to snack on? What am I going to do this and that and the other? Most of us, myself included, when I snack between meals, and I can tell that I don't feel as well. To me, that is the best way to do this. And over the years, I have just incorporated that principle. I'm not pushing anybody, but I might encourage them and pull them along if you know, I can. Because when we start making those positive changes, we start feeling better. There's no better way to enhance and maintain a positive lifestyle, you know, change. And so I would encourage you, incorporate. You know, it's pretty crazy. You know, here a couple of months ago, I took an individual that was absolutely positive she was going to go to hell if she had ice cream. And I'm going, what are you thinking? Because she had worked herself into that mindset of, I can't have any ice cream, I can't. And I looked at her and I said, you know, I'll even write you a prescription for it today because I need it to happen today. I want you to stop at the store and I want you to buy some ice cream. Okay? And I mean, there's a lot of, you know, people out there that would start quivering. They go, wow, you know, Rob did lose his last marble. It's a good thing he's in psychiatry, right? But I will tell you, therapeutically, when that individual, you know, contacted me later that week, smiling muscles were were re-engaged. That I can't mindset was significantly diminished. And I'm going, okay, now she went from trudging, now we're starting to reconnect with quality of life. And it's just kind of fun, and because we're starting to realize that, yeah, you know, I'm not going to die of a heart attack tomorrow because I had a small bowl of ice cream last night. And then we start going, you know, yeah, the effects of dairy, we've talked about a lot in this class. So then I go and I look at some non-dairy options, and I really enjoy that. And I'm doing that in moderation, and I'm not going overboard. Now all of a sudden we've got balance, and we are getting away from that I can't do this, I can't do that, because nobody's going to like that. Yep.
When you bring up, you know, like, oh, I can't get by with, you know, a snack.
Mm-hmm.
There's not one reason, there's lots of reasons. First of all, it's also habit. It's also you're oppressing a weakness. So, yeah, I mean, it's your body's telling you, your mind is telling you that you have to strengthen something.
Right.
Is really what's happening. And it could be physical, it could be, you know, very important to you. And as soon as you strengthen those weaknesses, you'll be able to get through the 4 or 5 hours before the next meal. And
Yeah,
stuff.
absolutely. So it's a process.
It's a process.
We get our bodies used to
But
that.
each you might say these bad messages and habits you're doing is a message.
Sure.
And we should be listening.
Yeah, absolutely. And that's in connection with our total body response.
Even if it's an emotional, you know, one day
Uh-huh.
thing that's happening.
Right.
Anxiety is very common.
Absolutely. Total body response to everything that we put into our mouth. Again, terms that I use a lot in this class. And so when there's reference made to not snacking between meals, in this class we've studied this extensively, and we're going to be revisiting this over and over and over because it's so important. You know, when studies tell us that just the simple act of snacking between meals will delay gastric emptying. And that is even if we have an apple or an orange or something like that. Now that's going to have much less of a devastating effect than if we were to go after you know, some processed Danish or, you know, or pastry or, you know, whatever the case might be, or something, you know, even heavier. Our body's just becoming more and more burdened and more taxed. And, you know, as a walk-in provider years ago, I would see a lot of irritable bowel. And I will just tell you, irritable bowel symptoms are fueled and fed into oftentimes by the major lack of one thing, and that's a meal schedule.
Meal what?
Meal schedule.
Oh, meal
Yeah.
schedule.
Yes. So the meal schedule can have such a profound effect. That reversal of the wedge, you know, in our society today, if you and I just start polling individuals that are driving by here on South Jackson, how many people would have had a good breakfast fit for a king or a queen this morning?
Ew. I'm sorry, I'm not a breakfast person. It's very difficult for me to eat in the morning.
Number one reason that I see folks as an urgent care provider, number one reason that we have diabetes and obesity out of control. And it's so incredibly hard for folks to realize the incredible impacts that not having a good breakfast has. So, and this is, again, I cannot underscore enough why we as a society are imploding, why our health is going downward. Because when we do not have a meal schedule, and if we do have what's called breakfast in our society, and it's a cup of coffee and a piece of toast, we run out the door. How does our body respond? How does our body process that? And then we then drive ourselves right into that I'm always hungry or I'm never hungry. And I will tell you, the folks that I have been privileged to work with in the 300 to 400 plus pound category, hands down, 99.9, I would say minimum, 99.9% of those individuals, breakfast has never been on the radar from a kid. So now we have this learned behavior on top of, okay? So they never eat a good breakfast. Well, what happens? So then their body is required to stay active. They want to get out, they want to move around. Well, at 400 plus pounds, it's going to be pretty difficult to get out and move around, right? Especially when it's 100 degrees outside. It's a lot easier to just stay indoors, become very sedentary, hit a remote button, turn on the TV. Okay, so now we have a sedentary lifestyle, but they only eat one meal a day because usually around 4 or 5 in the afternoon they're going to eat. Sometimes it's because they're getting a little hungry, other times it's because they know they got to eat something. Okay, so then they eat, and they are trying to eat better. They're trying to eat salads. They're trying to eat less of a portion because they used to. There's been a history of eating a large meal. Okay, wow, what a scenario. So starving themselves. Okay, so what happens when we don't eat a good breakfast? We start starving ourselves. We
Your
send
body goes into starvation mode.
Absolutely. So anything that we eat, when we don't meet the needs of our body will become specialized in making fat out of salads.
It's amazing how that happens.
And then, as they've been 250, 300, 350 pounds or more, at some point in their history, oftentimes they try to go to the gym because they're just going, oh man, I'm not eating that much and I'm still gaining weight. So then they go to the gym, going, wow, this is where insult rolls into injury massively. Because now they're putting 50 miles of fuel into their fuel tank. Okay? And that's referencing that one meal that they're putting into their body. So we've got 50 miles of fuel that they're putting into their fuel tank. Now, instead of the normal 100 or 200 miles during the day, they're going to go to the gym. Now they're going to say, okay, I'm asking my body to go 300 miles today, but yet expecting their body to function on 50 miles of fuel or less. That's why we could go to any gym and there'd probably be about an 80% rate of frustrated folks because they're gaining weight instead of losing weight. Because they have not led with one of the most important criteria, and it is they have got to meet the nutritional needs of their body long before they started requesting their body to become a triathlete. Make sense?
3.5 weeks ago, I weighed 211 pounds.
Okay.
Okay. I was drinking 2,200 calories of beer a day.
Wow.
Okay. And having maybe one meal. And I was getting this huge belly.
You bet.
And it was, I'd been in kind of that drudging mode for about 3 years.
Oh, wow.
From illnesses and not handling it right.
Sure.
Finally, things were turning around, but I wasn't accepting that.
Yeah.
I was still stuck there, so I finally made a decision 11 days ago, no more beer. Okay.
Wow.
It was going to be right after the Warriors won the championship. And so I stopped that and I started a vegan diet.
Awesome.
I slipped once, okay? And I got that plant plate. And I went with the savory and the sweet breakfast quesadillas.
Yes.
That's all I really had. I kind of incorporated a few things. I'm at 190 right now, 191.
Congrats.
And my group ex-girlfriend came over yesterday and said, you know what, are you sick? Like I lost so much weight so quick. And actually it's like, I can't believe it because it's actually some of the spare tires going on.
Sure.
And now it's unbelievable.
Absolutely.
But I know that I'm getting protein, I'm
Awesome.
eating, and it's amazing. So it is, I'm not sick, right?
Testimony.
Okay.
I like it.
Okay.
I like it.
Yeah.
Yes, Millie.
What, have you heard anything about metformin as being negative?
Have I heard anything about metformin being negative? Well, I will tell you, yes. but I've also heard a lot about metformin being positive, okay? So as a healthcare professional, you walk into my office, if I'm a walk-in provider, we have diabetes, we have marginal control. Metformin's going to probably have the lesser. I'm going to do a cost-benefit analysis and say, okay, what are the benefits? What are the negatives? And I will tell you, metformin works from 3 different areas to make your body more sensitive to the insulin your body's producing. It'll make your body produce a little more insulin. I mean, it's just one of those medications that can have significant positive benefit, and I look at that as one of those pharmaceuticals. Oh, my little thingy shut off. Here we go. So I'm going to look at this as one of those pharmaceuticals that will make a difference in the disease process. I think I might be locked up here. Uh-oh.
Okay. Out of curiosity,
Yes.
since I've sat down, I can't grasp exactly what this is, as far as the terminology. and
Oh,
stuff.
a cheerful heart. So in other words, positive mental attitude.
This right here?
Oh, gotcha. Oh, that I'm not familiar with. I'm sorry. Yeah.
Okay.
There's going to be some herbs that I am not going to be familiar with that Dr. Rogers, Proponent Rogers,
Okay.
references, but we'll look into those.
Just wanted to say one more thing.
Yeah.
I found myself very satisfied, not wanting, very satisfied, fulfilled, small, one burrito for hours. So I didn't feel like I needed
Nice.
to eat and stuff like that. It was very fulfilling.